The African Institute of Public Health Professionals, a specialized African hub for health professionals, is set to inaugurate the Sierra Leone chapter and induct new fellows. The theme for the occasion is building a resilient health system for universal health coverage and health security in Sierra Leone, progress, challenges, and the way forward. The Institute for Health Professionals Development is aimed at helping government and development partners in strengthening the national health system through health workforce development and maximizing public health impact through high-quality, relevant professional training programs that are linked directly to service delivery. Well, for more on this, I have in the studio Ade Renner, Advisor, Institute of Public Health Professional Development. Good afternoon, sir. Welcome to the board.
Thank you.
And now, I read a brief background, but I'd like from the horse's mouth. What does this institution entail?
Thank you very much. First, I would like to distinguish between this. There are two institutions we're talking about here.
Okay.
We have
this is the African Institute.
Yeah, there is the African Institute.
Okay.
And there is the local base.
Okay. So the Sierra Leone Institute.
Yes.
The chapter, Sierra Leone chapter.
Not yet.
Okay.
No, that's different. That's what we're going to introduce after the induction.
Okay.
Next week. Okay. Now, the African Institute for Public Health Professionals is comprised of healthcare professionals from the African region. Okay, and these are professionals with diverse abilities and also different cultural identities. But they decided to come together to help our different countries in this continent to eradicate as much as possible all burden of diseases that is affecting Africa. Okay, it is a very strong institute, and it's based in Abuja. And it has in Abuja various professionals from various countries. It's not only Nigerians who are seated there. No. Okay, there are experts from various countries who are putting things together to make sure that Africa gets the necessary support health-wise, okay, to improve on the health and well-being of their various people, the nations. Now, this African Institute, usually every year they conduct international conferences. They've already held one in Ghana, in Rwanda, in Egypt, and this year they will be having one in South Africa. Okay. Fortunately for us, the Chief Executive Officer for the home-based Institute for Health Professionals Development happened to be invited by this African-based institute to be the guest speaker at the conference in Ghana in the person of Dr. Fuad Kanu. He went there, he was inducted as the first Sierra Leonean, okay, to obtain that fellowship. So after the meeting, he thought it fit that Sierra Leone should be part of this institution, because before then Sierra Leone was not. Okay, this has been a snag. But he spoke with the leadership of this Abuja-based African Institute, and then later he came back to Sierra Leone. He spoke with the Ministry of Health, the ministers, Chief Medical Officer, and he gained their blessings. So he went back to the Abuja-based African Institute and told them that, look, our country is ready to be the first country in Africa to introduce this African Health Professionals Chapter. Okay. Now, this is why I said it's different totally from the IHPD in Sierra Leone.
Okay.
So this is why we are for now, and we are working on it.
Okay. So now the Sierra Leone chapter is soon to be established.
By the grace of God.
Okay. So now let's is there a particular criteria for someone like a medical professional to be part of it?
Yes, there are criteria. Now, just as I said, these healthcare professionals from various countries seated in Abuja, they met together and they came up with criteria to be inducted as fellow, as full member, and as associate member. Now, to be a fellow of the African Institute, you must have a PhD, okay, or a master's degree, plus 10 years experience in public health work. Then you'll be qualified. It's, as you can see, it's really very stiff. Okay. Now, to become a full member, you must have a master's degree. Okay, with less than 10 years. Less than 10 years experience in public health. Okay, and then the third category is the associate, wherein we might have an HND or a first degree in public health with at least 2 years experience. Okay, these are the set criteria.
Okay, so let's talk about Sierra Leonean medical professionals who fits the criteria that you're going, when this chapter is established, that are going to be inducted. How many?
Yes, after Dr. Fuad Kanu had actually got the approvals from the government of Sierra Leone to the Ministry of Health and from Abuja, the African Institute for Public Health Professionals. What he did was to bring it to the open in the country. Okay, applications were sent not to Dr. Fuad Kanu, no. Those who are interested, who thought that they fit to any of these three categories, they sent their applications to the Abuja-based institute. It is there that they looked at your CV or whatever you sent and then decided on what category you belong to, whether to the fellowship or to the membership or to the associate membership. So according to data which we have here in Freetown, 250 applicants were received from Sierra Leone. Now, the Abuja Institute decided to cap the inductees to 150. 150. So you find out that next week, 150 Sierra Leoneans will be inducted. Yeah.
So when inducted, they'll be part of the African Institute, not just the Sierra Leone chapter.
Yeah, that's very true. That's correct. They'll be, in fact, they are going to, after the induction, for those who will be fellows, will immediately, after their names, let's say, for example, my brother here, Bindi, okay, after the Bindi, you will have his fellow of the African Institute of Public Health Professionals, AIPHP. You understand? Immediately after his name, you see, which is a renowned.
So are you part of it?
Yes, I am.
A fellow or a member?
Fellow.
Congratulations, that's remarkable.
Yes.
But what you know, when someone hears the word institute, you'll think that it's a learning institution where you go and get more knowledge. Let's talk about, apart from they coming together so that they fight diseases and health problems all over Africa, what else do they do to capacitate the members?
The very first benefit is the networking, professional networking for all public health professionals. That's one big thing because that is currently missing, right? Now I'll give you one example along those lines before I continue. Now when we had Ebola some time back, because of the lack of networking between the Sierra Leone professionals in public health and the rest of the African professionals from various countries. They had to bring in so many other public health, so to speak, experts into our country. Okay, they came, they helped us with the Ebola, and of course at the end of the day we were able to eliminate it. But then there's always, I always say one thing, there's always a difference between growth and result. So the result we had there was the elimination of the Ebola. Okay, but then was there any growth? The growth is the capacity development. Was there any networking? And this was evident now when we had the COVID-19. Not many experts came into our country. Our own professional health workers, they stood the challenge, and we were able to succeed, to go through it successfully. The same is happening for even the mpox, which is currently affecting our country. Okay, we have not invited any outside professionals. It is our own health professionals through the Ministry of Work, the Ministry of Health, I'm sorry, that are actually handling these mpox issues. Right? And two, there is also the possibility to do a lot of scientific research work. Okay, this is why the annual conferences or the yearly conferences, which are held by the African Institute, okay, becomes very relevant, because if we conduct a research in Sierra Leone, we can easily take it to the conference, do a presentation on it, and the other professionals within the continent, okay, who participate in that meeting, we gain ideas, we can exchange ideas, we can talk, okay, and see how it fits the findings or the recommendations, how it fits into the various health systems of our countries in the continent. Okay, so I think that is very, very good. And over and above that, we are happy for having this induction in Sierra Leone as a first chapter in Africa, because if, for example, these 150 people who have been selected for fellowship, for full member, and for associate member, we are to go to South Africa, where the next international conference will be. You can imagine the huge amount of money that will be paid, the air ticket, the accommodation, and everything, because it is not the Africa Institute that is going to pay for you. No, you pay for yourself. Okay, you pay for yourself. You go there. It is then that you will be inducted. Okay, as a public health professional. So there are so many benefits. Thank you.
Okay, well, thank you so much. Continue to stay with us. We'll come back to you because we want to know how the induction will be like and what else is there in all of this, and the difference between this African Institute and the AIPHP you mentioned. Okay. So continue to stay with us in the program. His name is Ade Renner, doctor, I guess. Advisor, Institute of Public Health Professional and Development. Well, the program you're watching is a podium coming to you live on SLBC television in Freetown. We go for a short break. When we come back, we continue with our guests. And now, Mr. Ade Renner, now this April, the induction, how is it going to be like?
Oh, yes, we are going to receive delegates from the African Institute in Abuja, the director and a cross-section of our team out there will be coming. And we're going to have also the representative from the AU, the African Union. They too are coming because they are very proud of this African Institute. And they are also proud that at least Sierra Leone is going to be the first country to establish an African Institute chapter in the region. So they'll be coming, and of course you have to launch the induction ceremony is the Minister of Health himself, Dr. Denby, and we'll be graced also to have his two deputies, Professor Senesi and Madam Jalika. Hopefully they'll be there, and of course we have other dignitaries will be joining the ceremony. And we're having it for 2 days, the 25th and the 26th.
Okay.
2 days because that number 150 is
so
huge.
where?
It will be held at the Freetown City Council. Freetown City Council, 25, 26, 2 days. But preceding that, on the 24th, we'll have a sort of symposium. This will be at the Institute of Health Professionals Development at on your way to Waterloo. The institute is there, wherein we have our own professionals from the various universities, okay, in the country, who will be presenting papers, okay, and we'll be having panelists discussing those issues, and they will be subjected to various questions as we are doing now.
All right. So, like just as you mentioned this IHPD, what's the link between these two institutions?
Well, the link is that the IHPD is home-based. Okay, it is completely separate from the African Institute, that is regional. But I believe that with the establishment of the African Institute chapter in the country, the IHPD will be a sort of conduit, okay, to make sure that things work properly.
All right. Well, thank you so much.